Virginia's Prescription Drug Monitoring Program, or PMP, is a powerful tool designed to help Virginia's health professionals prescribe safely and to prevent the diversion, misuse, and/or abuse of controlled substances. This robust program collects, monitors, and analyzes electronically transmitted prescribing and dispensing data. The interconnected PMP database helps prescribers promote the appropriate use of Schedule II through V drugs for legitimate medical purposes, including pain relief. In addition, the program's archiving feature helps prescribers prevent the misuse, abuse, and diversion of controlled substances. It's this critical combination of features that makes the PMP valuable for encouraging safe, appropriate prescription drug use on a day-to-day basis. Let's take a look at one real-life example of how the PMP works.
I had a 62-year-old female patient who was being admitted to the hospital for elective surgery. I reviewed her medical history prior to the surgery. The patient, Mrs. Weaver, gave me a list of her medications, which included fentanyl patches that had been prescribed for chronic pain. Based on the information she provided, I wrote a post-op order for a short-acting opioid, in this case for the fentanyl patch, at a higher dose than usual, thinking that Mrs. Weaver had developed an opioid tolerance due to the routine use of the patch for pain relief. However, and here's where the value of the PMP is clearly demonstrated, the hospital pharmacist received the order and discovered by using the PMP system that Mrs. Weaver had not filled a prescription for the fentanyl patch in the past 8 months. When the pharmacist told me that, I immediately modified the post-op orders so that she did not receive the increased dose of the fentanyl. Mrs. Weaver was actually opioid naive, and the increased dose might have caused a respiratory compromise or worse.
As demonstrated by this actual medical case, the PMP is a valuable resource for ensuring and enforcing safe prescribing and dispensing habits. It can be used not only to monitor compliance with the patient's treatment plan, but also to ensure the critical coordination of care with all covered substances. Let's look at more of the specific characteristics of the PMP. The digital platform, designed to ensure patient safety for covered substances, gives dispensers specific data fields, including patient demographics, prescriber's name, the specific medication, and the dosage. The 24/7 Access database covers Schedule II through V prescriptions, plus gabapentin and naloxone. All PMP data is available in real time. Every prescriber and pharmacist is authorized to use the PMP by virtue of their state of Virginia license. In addition, any prescriber may have one or more delegates who may query the PMP database. Virginia's PMP data is not restricted to just the Commonwealth. Rather, the system works with 30 other state databases, including our border states, Maryland, North Carolina, West Virginia, Kentucky, and Tennessee, and the District of Columbia. So, when the PMP is searched, information from interconnected states is available. Many electronic medical record systems, EMRs, are integrated with the PMP, which means that data is only a click away. The data in the PMP is protected, secure, and in general cannot be shared. The PMP can also inform and protect a prescriber. One-page reports are designed to inform prescribers of their prescribing practices. These reports allow a prescriber to compare their prescribing with peers within role and specialty. A metrics document sent quarterly accompanies the report. Important announcements and alerts are also delivered to prescribers through the PMP. In 2017, over 18 million requests were made to the PMP, with more than 90% of them by prescribers and pharmacists. The PMP archives an unbiased prescription history of covered substances to inform treatment and dispensing decisions when initiating care of a patient. As we saw earlier, this is a critical safety feature for ensuring appropriate patient care. Let's look at another example of the PMP doing its job, this time for a dental patient. Again, this was an actual case.
Mrs. Butler, a 28-year-old new mother, had 4 impacted wisdom teeth. Well, as is my routine, I preoperatively prescribed 7 days of a short-acting opioid. But before I gave the prescription to Mrs. Butler, I checked the PMP and discovered the patient had current prescriptions for Xanax and Valium. When I asked about the prescriptions, Mrs. Butler explained she was being treated for significant postpartum depression, didn't realize that it was important to mention she was taking the medications only as needed, not every day. The PMP check prevented a dangerous situation of overprescribing controlled substances that would have put the patient at potential risk of being overmedicated. Instead, we went with round-the-clock NSAID alongside acetaminophen for post-op dental surgery pain.
Once again, doing a PMP check avoided putting a patient at serious medical risk. As Virginia continues to grapple with the opioid overdose epidemic, it's important to recognize other benefits of the PMP that are of particular relevance to fighting this public health issue. The PMP provides a tool for proactive reporting of outlier prescribing and dispensing for possible investigation. The PMP is a source for proactive reporting to law enforcement of doctor shopping behavior by individuals dealing with possible addiction. It assists law enforcement to reduce doctor shopping, drug diversion, and illegal prescribing and dispensing. It supports health profession licensing boards with licensee investigations. And it facilitates analysis of data by medical or non-medical professionals. It's important to remember, however, that the PMP's primary value is not as a law enforcement tool.
As I've learned, the PMP system is an invaluable means for identifying and avoiding unintentional overprescribing of controlled drugs for pain relief.
Patients don't always understand, nor should they be expected to understand how drug interactions can be potentially dangerous. The PMP system reveals critical information that can keep our patients safe and medicated appropriately.
For more information about Virginia's Prescription Drug Monitoring Program, or PMP, please go to the following website.